to go to attend the centre and to be seen face to face with by a GP for their treatment. So there are facilities available for them to be seen. Telephone triage, telephone consultation, and then referral for these to these amber sites. Failing that, there are also home visit services that are available for these patients. Again, networks of GPs have collaborated under the umbrella of the PCN, the primary care network, and they can organise home visits for them. So there is no reason why you shouldn't ask for help for day-to-day conditions. So for example, if you're a diabetic and you have an infected foot, or if you've had a urinary tract infection, or if you've got abdominal pain, you must speak to your GP. A lot of the common complaints is difficult to get through, the phones are always busy and so on. But please keep trying and do not give up. In terms of hospitals, if you do need to attend hospitals for routine appointments, they're not doing any routine at the moment, they're redeploying. But if it's anything urgent that the GP has referred, or if it's, for example, central chest pain and the patient thinks they're having a heart attack, they can call 999, and if the ambulance paramedics think they need to go, they will go. I think you have to be quite sensible about it, and at the end of the day, not sort of delay getting help simply because you feel that you may catch coronavirus or COVID-19 from these places. As GP surgeries, we have restricted footfall into the surgery for this very basis, that we don't want people coming in with COVID-19 symptoms, and they should be calling NHS 111. But on a few occasions, we have seen patients where we needed to on an urgent basis, and we got them sorted out. So the message, I think, to our elders is please, 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 do call the GP, do call the NHS 111 or the hospital if you feel you need to get help.
How serious is the COVID-19 illness? I know you've spoken about this,
yeah.
But people, I feel, are still not taking, some people, not all, some people have taken it very serious. Some people have not taken it so serious. To those who are not taking it serious, how serious is COVID-19?
Okay, so COVID-19 is very serious. It is extremely serious from the basis that we don't have immunity to it. And in 80% of the people I mentioned can have COVID-19 and recover from it. Out of the remaining 20%, 10 to 15% can have moderate to severe symptoms and recover from it. And then 5% can go to ITU, but the mortality, the amount of people that die from COVID-19 increases with age. So there seems to be sort of a turning point around about the age of 50 to 55, where after that age, people tend to get more serious symptoms and they tend to suffer more from the illness. And if they have coexisting conditions such as hypertension, such as ischemic heart disease, diabetes, then their mortality rate increases further. So it is important that we do take it seriously for the benefit of these other people that fall in the high risk category.
In regards to its spread, Principal Deputy Director of the CDC, Dr. Imran Hussain, says this new COVID-19 illness, referred to by some people only as COVID, is spread in a similar way to the common flu or to influenza.
Yeah, that's correct.
Is that correct?
That's correct. So basically, it's a virus, okay? And like most viruses, it would be spread in a similar way. So viruses, COVID-19 and influenza would be spread in a similar way through respiratory droplets as you breathe, as you cough, as you sneeze. If you have mucus and you spit, and then some of it gets on your hand and your hands touch some other place, then it can stay on that surface for 1 to 3 days. And that's why it's important to clean surfaces. The thing with coronavirus, this new coronavirus, is called SARS-CoV-2. There have been other coronaviruses in the past, MERS, Middle East Respiratory Syndrome, and SARS as well. The thing with this is, the way viruses work, and for the benefit of your viewers, they rely on stealth. So they want to get into your body, into the cells, using a key that they have, which opens a lock of that cell so they can go in, and for the body not to detect them. And then they use the cell to make more copies of themselves to go on to infect other cells. Now, that lock that they carry is usually recognized by the body's immune system in something like influenza or the other viruses. So the body starts to defend itself from day one. But with the coronavirus, the immune system does not recognize it. So it does its damage in the respiratory airways, in the upper airways. And it uses one of the receptors on the lung airways called ACE2. It uses that to get into the cells, reproduce itself, make lots of copies, infect other cells, and then it causes all the problems. So that's why it's important that we do take it seriously. And they are working on a vaccination. How long that will take, we don't know.
Well, that brings me on to my next question. Are the test options available for normal people? I know they are for example, the NHS staff, and also as reports are coming out yesterday and the day before for people that are working with the elders, for example, in care homes. But for normal people who are worried that they may be affected with coronavirus, how easy is it for them to access tests for COVID-19?
Okay, so I think my knowledge on this issue is just as limited as your knowledge is, because we're all getting the information from the government. So I wouldn't be privy to any more information. And all we can go on is what the government tells us. At the moment, the capacity for tests is being increased, but nevertheless it's still limited. And therefore the government has to think, well, who will benefit most from testing? And when I say benefit, who will actually need to know if they are COVID negative or COVID positive based upon the vulnerable people they come in contact with, the patients they see. And usually these are the key workers. So it's the doctors, the nurses, the people on the front line. So they are given the priority. Then the next level is obviously your carers in the care homes and so on. And so what you have is you have a limited resource and you're trying to make the most of it by using it in the most effective way. And that's the decision that you're making, and that's the decision that the government is making, and therefore they're doing it on a step-by-step approach. I think COVID-19 testing will be available, or should be available, at some point in the future to most people. Who knows when and how, so it's a case of watching this space.
I know there's no vaccine available at the moment. And